Welcome back. Grab your mug. I've got mine. Today is National Coffee Day. Now, research shows coffee can support heart health, brain function, and a whole lot more. So it's not just about getting that morning jolt. Here to spill the beans on all of this is Dr. John Higgins, a cardiologist with UT Health Houston. Thank you for joining us, Doctor. I should have brought you a cup
cheers.
as well.
Yes,
cheers.
I've already had mine.
You've already had yours,
Yeah.
right? Do you start your day with a cup of coffee most days?
Normally, yes, I do. And I try to have about 3 cups in the morning because the research seems to suggest that the sweet spot is about 3 to 5 cups for most individuals.
Ooh, more than I thought. Okay, I like the sound of that. So we're going to talk about timing it in your day in just a moment. But first, let's get to some big picture issues here. How does coffee benefit us?
Well, the beans that are made making the coffee, Alona, have a lot of powerful antioxidants and minerals and vitamins in them. So what we have found is that when we've studied individuals that are drinking coffee on a regular basis, it tends to improve their vascular or blood vessel function, which means better heart health, better brain health, better health in the arteries of the legs and arms. So it has a really, really good effect on the vascular system, but also on risk factors for heart disease. So people that drink coffee tend to have lower blood pressure. They tend to have less incidence in diabetes. In fact, coffee actually helps to reduce insulin resistance. They also tend to be less commonly smokers, and also their weight is generally more healthy and their cholesterol is better. So I think it's the direct effects of coffee on the heart, but also the indirect effects on risk factors that are really, really beneficial to individuals.
It's incredible to hear all of that laid out because that's a lot of benefits. Is it the same for men as it is for women, or do we see a difference there?
It seems like for women, they actually might get even more of a benefit, but especially when they drink coffee in the mornings as well.
So I was just going to bring that up, the timing of this, because as I was looking through all this research from my very layman's perspective here, there is some pretty big research in 2025 showing it's the morning that seems to help the most.
Right. So I think that ties in with some indirect effects of coffee. So coffee has caffeine in it, and we know that caffeine kind of wakes you up. Okay. So, and we also know that sleep is really, really important for vascular function and for your brain function as well, because that's when most of the neurons kind of make the new connections when you're sleeping. So what they've found that people that drink coffee in the afternoon, they don't sleep as well because of the caffeine stimulant effects. So that's why going to the morning looks like it is the best effect, because caffeine tends to stick around in your body for about 4 to 6 hours for most people. So if you're out at a restaurant at night, go for the decaf if you're going to have one after your dinner.
Yeah, that's the way to go. Okay, so 3 to 5 cups seems like a lot to me. Can you overdo it, and should we watch for any signs that you're getting too nervous or jittery, and you might kind of start to take away that benefit?
So for the average person, 3 to 5. But, we know that there are individuals that are more sensitive to caffeine. They may be taking some stimulant medications that kind of added together with the stimulation from caffeine kind of...
Too much.
Too much, yeah. We know that breastfeeding women as well as children, we generally don't recommend any caffeine or very low levels of caffeine for them. So what I would say is whatever you're comfortable with right now, if you find that having 3 cups of coffee, between the morning hours through till the early afternoon is okay with you, then that is absolutely fine. But if you find that, your sweet spot is around 2 cups or maybe just 1 cup, that's also good. Now, a couple of things on the coffee. The decaf is not as good as the regular caffeinated coffee, okay? So it doesn't have the same benefits. When they strip the caffeine out of the decaf, they also take some of the beneficial antioxidants out. So that's number 1. Number 2, freshly ground beans are definitely the way to go. They have much more of the beneficial things in them rather than kind of, the instant coffees. Or if coffee's been sitting in one of those large kind of containers sort of for more than a few hours, and it's been boiling, it often degrades a lot of the beneficial materials. So the best way to do it is get your fresh ground beans like right before you actually have your cup.
Interesting. Fresh is best in this case. And then we
Yeah.
probably need to be careful just how much sugar and how much cream we're packing into it over the course of the day if we're going to have 3 to 5 cups.
That's exactly right, Alona. In fact, there's a lot of options instead of the sugar and cream. So, for example, putting a little bit of cinnamon or some other spice that you like, a bit of vanilla, that can actually give you a nice taste, but you're not having the calories and the fat from the sugar and the cream, respectively.
This has been my favorite interview of the day. Thank you so much for joining us, Doctor. I really appreciate this insight, and we'd love to have you back to continue this conversation.
Well, I'll cheers to that. And just to remember, Alona, tell your folks 3 to 5 is the sweet spot, and go for fresh. Fresh is best. Fresh beans.
Okay, Cheeto, I know we don't have to tell you twice.
No, I'm always a coffee drinker. Look at this. I did not even know. I just started putting cinnamon in my coffee.
Oh.
I did not even know, but it does.
You're on it.
I am with him. It really adds some flavor, and then you don't feel so guilty. You're like, okay, it's just cinnamon, right? But it